So welcome. Here we are going to talk about Prozac or fluoxetine, and here's exactly what you need to know about this medication. So, if you don't know, if my name is Agam Dewan, and I am a board certified psychiatrist. So it's my job to diagnose and treat mental health conditions with medication. And so, yeah, Prozac is a super common medication. Let's get into it. So, let me tell you about one of my patients, right? So, I have a 17-year-old male that I'm seeing right now, and he has been diagnosed with schizophrenia. And so, this gentleman, so he's already on it. He was on an antipsychotic. Basically, he was hospitalized because he was getting really paranoid. He started hearing things. He felt like people were breaking into his home. He stopped going to school as a result of this. And yeah, so basically, he was falling apart. And so he went to the inpatient psych unit. They had started him on Zyprexa, an antipsychotic, and then followed him up outpatient, right? And so I started seeing this kid, and he definitely noticed some improvement in the paranoia and the voices. But then another big thing that was happening was he was having some intense anxiety. And so, like, he was getting really anxious about all these thoughts that he was having, everything that was going on, people breaking in and things like that, right? He would still have the breakthrough thoughts. And like and so, but the thing was that he was worrying a lot about them. He was worrying that they would come back. He was worrying that they would, uh, still impact him. And so it was causing dysfunction in his life. And so we ended up starting Prozac in addition to the Zyprexa to start with to help with anxiety. And so that helped him a lot. And like now this kid, he's on like 40 milligrams. And so now this kid is able to go to school because his anxiety has gotten significantly better as a result from being on the Prozac. Right. So let me tell you a little bit about the history of Prozac. So it's a revolutionary medication, actually. So it was made in the 1970s. It's been around for a while by Eli Lilly, the pharma company. But before this medication come out, we mainly had tricyclic antidepressants and MAOIs, so monoamine oxidase inhibitors. And so the thing with these two medications is that they have huge side effects. Excuse me. So like like heart side effects, nausea, and like blood pressure stuff. Like with the MAOIs, you have to eat a certain diet or else you can get severe hypertension from it. So like pretty intense stuff, right? And so it was made in the 70s, but it didn't get approved. So like when a medication's made, it has to go through a lot of testing to make sure it's okay for the general public, right? And to make sure it actually does what it's been developed to do. And so they eventually in 1987, that's when they first approved it. So it was the first SSRI. And so like this thing became household name, like made movies on it, and it was discussed everywhere, news articles all around, because like this was like the first antidepressant treatment that was a lot more tolerable compared to the previous ones. And so because of that, because of the success of Prozac, it opened up the floodgates to all the other pharmaceutical companies wanting to make their own version of it. So that's where like Zoloft and Lexapro and Luvox, like all those things started coming out after that. And so let's dispel some of the myths that are with it, right? So the perception of a Prozac, any kind of antidepressant, is that it's like a happy pill, right? Like you just take it and you immediately become happy, or that it'll like numb your personality, or it'll completely make you a zombie and things like that, right? Like that's a huge misconception that a lot of people have. And like, that's not really the truth. But the truth is that medication like Prozac is just part of a treatment plan. And like you might use it with therapy, lifestyle changes, all of that to treat specific conditions. And so, for example, we use Prozac to treat major depressive disorder. We use it to treat OCD, obsessive compulsive disorder, panic disorder, generalized anxiety disorder, bulimia. Like these are conditions that Prozac has been approved to treat and has shown evidence to actually help with those conditions. Because like these conditions, they impact your life quite significantly. And if you can take a medication to help deal with like whatever it is that you're struggling with, then like there's no shame in that. If you have an infection, you take antibiotics without thinking. If you have severe diabetes, you take insulin because like that's what brings your blood sugar down. So it's no different. And so here's like a simple breakdown of how Prozac works. So basically what it is, it's called a serotonin reuptake inhibitor. selective serotonin reuptake inhibitor, SSRI. And basically, this is what we call a synapse. So it's the junction between one neuron and another neuron, and this is the synapse, right? So what happens is that this neuron, it releases serotonin, and that serotonin signals a electrical signal to the next neuron, right? So like let's say the signal for basic, like let's say the signal is, oh, feel more content, and so it's sending out serotonin um, to tell this neuron, hey, we want to feel the emotion of content. Because remember, emotions are just neurotransmitters in your body. And so, right, so what's happening here is that normally, like serotonin, it comes in here and then it touches the receptors, it signals it, and then it comes back and it gets reuptaken. But so for people with depression, they may not be releasing enough serotonin, right? Or like they are, but it's not getting them the effect that they want. This is very basic, rudimentary. It's much more complex, but like it conveys the point. So then what Prozac does is it blocks the reuptake of serotonin. So that way that serotonin will hit the receptor again and again rather than hitting it once and then coming back. And so then you have more of a downstream effect here. And so because of that, that's what's causing the increase in mood. So I'll share another story with you, right? So Prozac is one of the best medications for OCD, obsessive compulsive disorder. And so I had a female in my residency, mid 50s female, and she had significant OCD to the point where she was cleaning all the time. She had to make sure that everything in the house was spotless. And like if something was dropped, then it had to be wiped up right away. She had to wash her hands like 5 times when she did it because like there was germs. And so I had another patient who like had to rearrange his shoes all the same way, and if something was off, then like it distressed him till it was right. Another patient who had to check stuff all the time before they were leaving, check the locks a gazillion times, check the oven, check the stove multiple times throughout the day. They would drive and then come back to their house, make sure that the locks were still functioning, stuff like that, right? And so like that kind of stuff is really, really hard to treat. And so that's where medications can be really helpful. And yeah, so we started Prozac on all of those cases and titrated up to, let's say, 40 milligrams, 60. Generally, OCD requires higher doses. And yeah, so like for example, that lady got to the point where she could exist in the house and like there could be a little bit of mess and it wouldn't distress her. And then like the other person could leave the house without needing to come back and check that the locks were still locked, or like checking that their wallet was still in their pocket. They didn't have to keep on pulling out their wallet to check that. So the dosing of Prozac, typically you start at about 10 to 20 milligrams, usually 10 milligrams for kids. And then for adults, I like 20 personally, but like, you can start 10 if someone's like side effect sensitive. And generally we go up to 60 to 80. And this is usually to treat like PTSD and OCD are the higher doses. Depression have found good success at anywhere from 20 to 60. And so this is usually just taken once in the day, usually in the morning, because it's a very energizing antidepressant. And so some people do get sleepy from it, but overall, I've found it to be the most energizing. So it's usually best done in the morning time. And of course, just like any antidepressant, Prozac's got its own side effects. So it's got some nausea. So what I advise people is to take it with food, whatever their breakfast, or if they take it at lunch or whatever, like whatever their biggest meal is, and because that tends to reduce that. Headaches as well, that can be going on for the first 1 or 2 weeks. And the thing with all these side effects is they're usually temporary, and then as your body gets used to it, the side effects diminish. Um, Insomnia or drowsiness, like I mentioned, so some people get awakened, whereas others get sleepy. So that's just, you have to try that, see what it is for you. There's GI issues, so like just like the nausea I mentioned, like diarrhea or constipation. Usually taking it with food helps because it slows down the absorption. It's not as quick, but this is something to be aware of. And sexual side effects can occur too. So either difficulty getting it up, so like erection, sexual interest, like orgasm or having a sexual interest. Orgasming can be difficult too. And usually these go away with time too. And so the way that we mitigate that is we increase the dose slowly and, kind of let your body get adjusted to each step. And now let's say that you're on Prozac and you want to come off, right? Well, usually it's pretty easy. Prozac's the easiest antidepressant to come off, and that's because it has the longest half life, meaning that it lasts the longest in your system. So I think Prozac's like can last up to like 2 weeks or something. So this is good. This is good because usually the difficult antidepressants to come off are when the concentration jumps, right? So let's say it only lasts like 6 to 12 hours. Well, if you just discontinue suddenly, you went from like a concentration in your blood of, let's say, like 100 to now zero. And that's a huge drop off. And so usually we taper that dose to reduce that concentration slowly. But with Prozac, let's say we discontinue it immediately, then because it's still lasting a long time, it takes a while for that concentration to come down, and so it's a gradual change, so you have less withdrawal side effects. But many cases you still taper it, and like that's the optimal approach to go. And yes, so for the ladies out there, Prozac is safe in pregnancy. We often use it to treat major depression, or like what we call peripartum depression, so depression in pregnancy. And the reason it's important is because um, depression has huge impacts on the baby. So it can impact the like mom depression, right? So of course your self care might suffer if you are depressed as a mom. Might not do the things you need to for the baby. You might give into cravings of, let's say, junk food, or even worse, like substances, right? So that's key. Um, and there's some evidence to show that, like, if a mom is depressed, and like a lot of those genetics get passed on to the baby, like it's like an epigenetic thing where like mom's mental state gets passed on to the baby. So the baby is more inherently likely to be depressed if the mom is depressed in pregnancy. There's risk of preterm birth or low birth weight, especially in the third trimester. So like that is the small risk with Prozac, right? That's the main, like, the bad outcome that can happen. But it doesn't tend to be very common. And like as I was saying before, depression itself is associated with bad outcomes in pregnancy. So that's key too. Depression has its own problems in pregnancy. And so in my opinion, the benefits outweigh the risks. But of course, everyone's different. And so you have to balance that out and discuss with your own doctor. And luckily, the nice part about Prozac is that it's dirt cheap. It's been around since the 80s, so it's been generic for like over 20 years now. And this is the prices on GoodRx, right? So without insurance. So, $4 at Walmart, $4 to your shop, right? Target, I think, overcharges. So CVS always overcharges. So I would almost never go to CVS. So $20 here. And of course, insurance almost always covers it because it's dirt cheap. And yeah, so that's an overview on Prozac. So just remember a couple things. Like, there's nothing wrong if you're on psychiatric medications, right? It's not like a magical fix, but it's not like the end of the world either. It's just a tool. It's a tool to help you get your mental health to where it needs to go, right? So like you do what's right for you, right? You have a conversation between you and your psychiatrist or your doctor to make sure that like it's the right for you, and like the benefits outweigh the risks for you at the end of the day, right? Like we're all trying to improve our lives here to level up. And so leveling up your mental health is really important to leading a good life. So yeah, just remember that. And if you have any questions, just like leave them in the comments, or if you want to work with me one-on-one, then you can book a consult on my website. And yeah, let's go from there.